Hello and welcome to Spokane County Spotlight. I'm Commissioner Amber Waldref, and my guest today is Dr. Alicia Thompson, Administrative Officer of the Spokane Regional Health District. Dr. Thompson, welcome to the program.
Thank you, Amber. I appreciate that. I appreciate this opportunity to talk with you.
Well, it's so great to have you here. Before we get started, I thought it would be helpful for our viewers if you could tell us more about yourself, your background, and how did you get to the point of taking this position here in Spokane at the Regional Health District?
Well, I am a Spokane native. I was 14 years old when I moved here, so I call myself a Spokane native. Graduated from Lewis and Clark High School, got my bachelor's degree at Whitworth College, got my master's degree at EWU, and then I was working at the Spokane Regional Health District as an epidemiologist. And I worked there for 7 years, but I've also always had this hunger and drive to be in leadership. And so I decided to go on a leadership journey. And I accepted a job in Cowlitz County, over on the west side, as the deputy director. And then that was right around the time of 2008, 2009.
Yes.
Yeah.
I remember that time.
Right.
Let me guess, there was some budget cuts.
There were, and it just so happened that my salary and my benefits added up to the amount that we needed to cut. And so I was fully on board that they needed to cut my position. But what's unique about my story is that I submitted my resignation. My last day there was May 1st, and my first day as the health officer and executive director in Great Falls, Montana for Cascade County was the Monday. So I just had a normal weekend, ended my day.
And then you moved to Montana.
And moved to Montana, yes. And so I was there for about 5 years, and that leadership part of me was like, I had a master's degree in social work, but I didn't have any formal education in public health. So I had that drive, and so applied to one school that I thought matched what my passion is in public health, and that was at the University of Arizona, Mel and Ida Zuckerman College of Public Health, long name, and they accepted me and offered me a research assistantship and teaching assistantships, and so we picked up and we moved to Arizona, and I earned my doctorate in public health policy and management.
Wonderful.
Yeah, and then after that was done, I went on to be the director of Cochise County Health Department, and then this job opened up. And I'd always dreamed and hoped that I would come back to lead Spokane
And we got
Regional.
you back in Spokane.
Yes.
Well, it's so wonderful to have you. I sit on the Board of Health,
Yes.
and so I was part of the process of hiring you. And this year I get to be chair of the board, and so we're going to work really closely together, and that'll be great.
Yes, I'm looking forward to it.
Well, wonderful. You've had quite a career, and now you're here helping us out here and making sure we have a strong team at the health district and good public health here in Spokane County.
Yes.
So for those who might not be familiar with our health district,
Right.
it's not actually run by the county. It's a separate entity, Spokane Regional Health District, but the county has a very strong relationship.
Yes.
Because we contribute dollars, we contribute support.
Correct.
The financial accounts payable go through the county.
That's right.
There's a lot of great partnerships.
Right. And that's all by law. The county has to be our bank, basically, the treasurer, the county treasurer.
We're connected at the hip, whether we like it or
Yes.
not. But no, it's been great to be on the Board of Health again. I served years back when I was a Spokane City Council member, and now it's great to be back on the board as a county commissioner. So tell us about just a quick overview of the health district and the mission and the programs. It's a very broad swath
It
of programs.
is. It really is. And that's a big question to answer in just a couple of minutes. And so really our mission is always about helping our community to be healthier in all the different ways that means. And all of our programs, I mean, we go from nurse-family partnership that really helps new moms to new moms who are at risk to have a healthy pregnancy, a healthy baby, and a healthy toddler, and grow up to be a healthy, productive individual. Best practice model, and it makes a difference in a lot of people's lives in Spokane. But you go all the way from there to over to the other side. I'm looking at the org chart in my mind, and it's we've got 5 divisions, and the other side is our disease prevention and response. And so it's like everybody kind of got to know public health through the COVID pandemic, because that work came out of our emergency preparedness, our public health emergency preparedness, and our response to COVID. And we do that every day, whether it's pertussis or Shigella or any of these other communicable diseases that are spread from human to human. We are always investigating those, getting at the bottom of where the source was, and getting it to stop as quickly as we can. But then we also have environmental health. And environmental health is the division that makes sure that when you go to eat at your favorite restaurant, you don't get sick.
Well, I remember when I was in high school, I had to go get my permit. I had to take the little test to be able to work in a restaurant.
Right.
And get my health card.
Right.
And so now I think they probably do that online.
All
I remember
online.
going to the
Yes.
to the health district building to have to get that. But that's, I mean, you touch the lives of so many people. Think of all the people that work in food service.
Exactly. And I actually firmly believe that public health touches the lives of every single person in Spokane County every day. And I mean, I know that because one time Mayor Winters, Great Falls, Montana mayor, he said to me, "Public health hasn't done anything for me." And I said, "Well, when was the last time you ate out at a restaurant?" And I said, "And did you get sick?" And he said, "No." And I said, he said, "Well, you got me." And then we went on to write an article about how how public health touched his life in so many different ways. And whether it's our drinking water or everything. I mean, the school playgrounds, we inspect them so that they're safe. And so anyway, public health is a fascinating field to work in.
Well, it's been great. I've learned so much in the time that I've been able to be a board member. So yeah, I agree. It's fascinating and challenging, right?
Yes.
Because there's always unfortunately, there's always new diseases, there's new outbreaks, there's new technology and science behind understanding what's going on, and the data center at the health district is amazing.
Exactly.
If anyone hasn't checked out the health district's data, if you go to srhd.org and look for the tab that says health data, you have a team that collects data and presents it back to the community.
Right, and we have dashboards like the opioid dashboard.
Yes, and the new homeless data
yes,
is up there.
the new homeless dashboard. So there's a lot of information and the data center is phenomenal. We have organizations that reach out to us all the time to help them with the data they need to write grants or write out reports. They are a real blessing to Spokane.
They've been a great partner with Priority Spokane.
Absolutely, yes.
Well, so we talked about a lot of different areas.
Yeah.
Now that you have a year under your belt at the health district, back at the health district, what are some of the areas that you've really focused on in that last year?
You know, a lot of times when so everyone went through a horrific time with COVID, and it really was an upheaval
Yes.
of everything that everybody did. And so,
So
in
much.
addition, SRHD had some turnover in leadership, and that always causes a disruption to an organization, and you lose some of the consistency in processes. And so I've really been working on helping our team to kind of come back together, move forward together. And that's,
My first year back on the board, so in 2023, I got to attend the National Associations of Boards of Health conference. And the main topic of that conference in August of 2023 was the public health workforce
yes.
and how
Yeah.
so many people left the workforce because it was so stressful.
Yes.
And then
Yes.
trying to recruit people back into the workforce.
Yes.
And so it's a big topic. I
It
think
really
I
is.
think it has improved, and I think we have more stability, which is excellent.
Yeah.
But we need good leadership to continue to support the workforce
Absolutely.
because they have a big job to do, and
Right.
sometimes it can be challenging and mentally draining. And so making sure we have good supports for our workers in the
Yes.
field
Yes.
is incredibly important. So speaking, you mentioned the opioid data on the
Yes,
dashboard.
yes,
So one of the unique things that the health district does is we have, as part of our portfolio, the opioid treatment program.
Yes.
So tell me
Yes.
more about that program. What does it
Sure.
do? Is it growing as we see more opioid deaths and people overdosing in our community? How does that fit in, and what role do we play in that?
Well, as you mentioned, we do have the opioid treatment services, and there's a lot of kind of confusion, I would say, about all the different pieces of how we are addressing the opioid crisis. And so what we do at our treatment center is we help individuals who are already addicted to an opioid, whether it's heroin, fentanyl, or prescription drugs. We help them to overcome their addiction through what's called a medication-assisted treatment.
Sometimes people call it MAT.
MAT,
M-A-T.
exactly,
Okay.
a
So
MAT.
that's what that means.
Yes.
You're getting medication to
Yeah.
help you as you are being treated for the
Correct.
substance use.
Now, opioid addiction, though, is a chronic disease. And so once you've been addicted to opioids, it's very difficult. Like, there's other addictions that you can just eventually walk away from, but opioid addiction is more like diabetes or asthma, where someone that's insulin dependent, they're going to need their insulin for the rest of their life. And it's the same with someone who has asthma. They're going to need an inhaler for the rest of their life. And so with the MAT services, we have some of our patients have been on our program since the very beginning of when we
And I think
started.
we were an innovator in
Yes,
bringing
we
on
were.
that program
Yes.
over 20 years ago.
Yes, yes.
Yes.
Right now I don't have the exact date, but it was in the 1990s. And no one else was doing it, and yet Spokane at that time had a really bad heroin problem. One of my high school friends, she died of a heroin overdose. And
So that's when it started
Yep.
to have this treatment program, and now
Right.
it's just really grown.
Yeah, it has. And we have on average somewhere right around 950 and 1,000 clients that we help every week. So that's weekly. That's our average weekly number of patients that we provide methadone or bunephrine to. It's primarily
Now,
methadone.
There was some conversation about, because it's not normal that health districts
Right.
actually usually have a clinic, an opioid treatment clinic.
That's correct.
So I know the board has had some discussions about, is this the best place for that? Are we the best organization to host
Right.
that?
Right.
But we have decided, we had a big conversation about it over the
Yes,
last year.
yes.
And we did decide, we have a pretty amazing treatment program.
Yes.
Let's put off conversation about whether it should be here or somewhere else and really focus on how do we make the program more accessible and even better?
Exactly.
Because we have a lot of people that unfortunately we can't have always same day appointments for.
Right,
Because
exactly.
there's people coming in and we don't have the staffing always to manage
Exactly.
that. So we're looking at ways that we can do better.
Exactly.
How can we have more staff
Yes.
or change shifts or make
Correct.
it accommodate the kind of center the person, the patient?
Yes, yes, exactly. And that is, and all the feedback that we got, whether it was from community members or our patients or our employees, the researchers that we work with, everyone was really pretty adamant that we needed to try to keep treatment services within the Spokane Regional Health District. And so we're really focusing in on how do we ensure that anyone who walks up to our building during the hours that we're open and wants to get onto the program, that's like they've reached that moment in their life where they're just done and they want help to address their addiction, that we can assess them and get them enrolled into the program. And it's a 3-hour thing to go through that assessment process.
Right.
So it really is resource intensive with staff.
Well, I'm looking forward. I know we're making
Yes.
we're making some investments
Yes.
in the staff, the leadership, the medical record program.
Correct.
All of these things to just make it a better and even more accessible service to
Yes.
the community.
Absolutely.
But there are now more treatment programs that are
Yes.
available to people. So we're not
Right.
the only treatment
No.
program, which is good. That
Right.
means people have choices.
That's right.
Yeah.
That's right.
Well, tell me about the other topic I wanted to talk to you about was the new strategic plan.
Oh, yes, yes.
I've been able to be on the committee, the kind of executive committee of lots of different community members, board members, staff, as we create a new 5-year strategic plan for the health district. So I thought maybe you could just tell us a little bit about what are some of the key goals of this new
Yes.
strategic plan, and the board will be looking at that and looking
Yeah.
at adopting a plan here in the next month.
Yes, thank you for asking. We are so excited, and throughout this entire process, we have incorporated our employee feedback and community partner feedback as well. And what we've landed on are these
our goals, okay.
four primary goals, and of course each goal has objectives underneath of it of how we're going to achieve this. But goal number 1 being visible and trusted in the community, just helping all of our community members understand all the things that we offer and make sure that people know what we have to offer.
And that they trust
Yes.
that we can provide accurate, data-driven information
Very
and
much
support.
so. Yes,
Right,
yes. And work with our healthcare providers to help them navigate.
right. When we have disease outbreaks.
Exactly,
Right.
exactly. And then goal number 2 is be a model for evidence-based decision-making. And that really goes back to the data center and all of the work that we do to really provide evidence, data-driven evidence for making decisions. And so we are embracing goal number 2 internally throughout our organization, but also offering it externally to anyone in the community who needs data, any type of data, reach out to us. We probably have it.
Yes.
And then goal number 3, I'm very excited about, and it's a workplace where everyone is valued. And we talked a little bit about this earlier, But, you know, everyone has gone through a really traumatic time in history. And as we move forward, we want to make sure that every single one of our employees at SRHD knows that their contribution to what is happening, the work that we're doing for our community's health, that it's appreciated, that it's acknowledged, and that we know we can't do it by ourselves. And then the fourth goal is really about those internal processes,
Right.
ensuring that everyone knows what the expectations are and how to meet those expectations. So get rid of the gray. Help everybody know how to
And
meet.
be more efficient when we
Yes.
have the new, for instance, when you have a new system
Exactly.
for medical data at
Yes.
the opioid treatment, keeping track of who's coming in, when, and how many patients are being seen.
Yes,
That information can help you do better.
absolutely.
So being more
Yes.
efficient is not always about like cutting corners at all.
No,
It's
it's
about how
not.
do we serve people and get more people in the door, or with the nurse family partnership, you know,
Right.
making sure we're being as effective as possible when our nurses
Exactly.
are going out in the community. So.
Yes, yes.
Well, so you mentioned the COVID-19 pandemic. We can't end this program without talking, unfortunately, about, you've mentioned several times about the impact of
Yes.
the pandemic on everyone around the world, but especially in the public health universe. So what are some of the most important lessons that you think you've learned after living through that down in Arizona?
It was
right?
in Arizona, and so my experience really was quite different than the experience that you had here at SRHD. There's multiple things that were different. Number one, Cochise County, Arizona is a home rule county. We are not home rule in Washington
Right, the state of Washington really directs
Exactly.
what happens, okay.
And in Cochise County, the county commissioners were the ones who directed. And so we never had mask mandates or vaccination mandates. And we worked with our community partners. We had developed a healthcare alliance that was made up of all of the different healthcare entities in Cochise County. And we started working on that even before the pandemic hit. But when the pandemic hit, having that community partnership, the community collaboration,
So
it
that's
was
a-
critical.
So moving forward, we can say
Yes.
we need to keep building those strong
Absolutely.
collaborations
Yes.
between healthcare,
Yes.
between community organizations.
Absolutely.
And that's part of goal number one, being trusted and
Exactly.
visible in the community.
Yes,
right?
and Dr. Velazquez does a phenomenal job of convening.
Our health officer, yes.
Yes, our health officer.
He loves people.
He does.
He loves
He
gathering
does.
people.
Yes. And so, but making sure that people don't get lax and think,
Right.
you know, we have to maintain that collaborative state throughout Spokane County. And then the other thing was a lesson that I saw very active in our county was that, you know, we are independent beings. We really don't like being told what to do. And so in Cochise County, we just kept giving people the information, giving them the facts, letting them know, you know, having high profile people like yourself saying, I've been vaccinated and I feel great and all of that. And so we had really high vaccination rates in Cochise County compared to some of the other counties in Arizona. And I think it's because we were just like, here, we made it available, we educated, but we never told anyone they had to.
Yes.
Yeah, very
We're-
different, very different.
Yes.
Yeah.
But I think that's important. The other lesson learned is probably you can approach these things from many different angles, but the most important thing is being communicative, like you said,
Yep.
lots of information,
Yes,
and having key members of your community that people listen to,
yes. And trust.
be able to communicate.
Yeah.
So those are all good lessons learned from.
Yes. Yeah.
Oh, man. Well, I certainly hope we don't have another pandemic anytime soon, but I'm confident that you and your team are preparing and always learning from the past and
Yes.
being even more prepared for the future.
Yes.
Well, as we wrap up, are there any other final messages or thoughts on public health that you'd like to share with the audience?
Well, if you're ever looking for a public health career or a career, I would strongly recommend looking at public health. It's a very exciting field. It's never a dull moment, and there's so much opportunity. And the staff and the programs that we have at SRHD, we really care about our community and helping our community be healthier.
That's wonderful. Well, all right, check out srhd.org. If
Yes.
you're looking for a job opportunity or ways to get involved or just to check out the data
Yes.
and learn more about our community.
Yes.
Awesome.
And our programs.
Thank you.
Yes.
Well, thank you, Dr. Thompson. This has
Yes.
been a lovely conversation. I'm afraid we're out of time for today,
Right.
but I'd like to remind our audience that this program and videos from all our public meetings at Spokane County can be accessed on our homepage and on our Spokane County YouTube channel. Thank you again, Dr. Thompson, for joining me.
Yes, thank you.
And I'm County Commissioner Amber Waldref. Thank you for joining us for Spokane County Spotlight.